Hello and good afternoon, everyone. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: renal calculi. Renal calculi, or kidney stones, are hard pebble-like pieces of material that form in one or both of your kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be as small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems, such as an urinary tract infection, commonly known as UTI. So, to shed more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. D. Srikanth Reddy, MS M.Ch Urology. He has a rich experience and hands on expertise in urology, BPH, and stone management. He's currently practicing at Sri Dhanvi Kidney Care, Sri Balaji Hospital, Nandyal. He has wide experience in more than 10 years in this very field, working as a senior urologist, and has wide experience in laparoscopy and robotic surgery, expert in transplants. Dr. D. Srikanth Reddy has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Reddy.
Hello.
Hello, are you getting my voice?
Yes.
So, Doctor, it's such a pleasure to have you with us. And today, as we are going to discuss about kidney stones, first of all, we would like to understand what are kidney stones.
Actually, kidney stones are some kinds of mineral deposits which will be excreted from the kidney because of our routine activities. When they are in a small quantity and if you are passing large amounts of urine, they will be dissolved in the urine and they will be excreted out. In patients who take less water and who has some other medical problems, in those patients, these minerals will get in excess quantities in the water, that means urine, and they get precipitated to form stones. They will start with a small stone, pebble-like stone, and they keep on increasing over a period of time because of the deposition of the new minerals onto it. So, depending upon the size of the stone, patients will have different symptoms.
Okay. So, lack of liquid consumption is the only reason, or there are other factors as well, Doctor? If you can just shed some more light over that.
Yeah. The most important factor which we consider is the water intake, because if some other problems do exist because of the water intake, those problems can be overcome. uh, um, Even the water consumption is not only important. Some patients will have some renal pathologies which will cause the increase in stone burden in the patients, like high calcium levels, patients who have parathyroid symptoms, patients who have renal failure. In those patients, there will be some kind of mineral excretion more, and which will lead to the deposition of the kidney stones and the formation of the new stones.
Okay. And talking about these symptoms, doctor, one is definitely excruciating pain. But other than that, what are the symptoms which we should never, underestimate and seek help right away?
Actually, many of the stone patients come to us with pain. Stone which has migrated into the ureter, and the body tries to excrete that stone. Because of that, there will be pain. Even in some patients, if you do some investigations for routine checkups also, some stones can be found out in those patients. That doesn't mean they don't have the stones, but they were not symptomatic because they were sitting in the kidney. When the stone comes to or migrates into the ureter, then they will have pain.
Okay.
So even without pain also, stones can be present. and depending upon the stone position and size, we will decide what is the type of management.
Okay, so when a person comes to you with these symptoms, or maybe no symptom, as you said, that when the stone is in the kidney, most of the time it's asymptomatic. For example, if a person is going through a general checkup or medical, reviews, etc., and he or she comes to know that there is a stone in the kidney, or else a person is coming to you with symptoms, what are the tests that you normally recommend for diagnosis?
Actually, if for a routine checkup, we will do a complete urine examination, then complete blood picture, serum creatinine to check for the function of the kidney. To assess the stone, we need to go for imaging modalities like ultrasound abdomen, which is the basic test we do for stones. And in that, if you find some other stones like bigger stones or something, then we will go for CT, which is a definitive investigating modality for the stone. So in a CT, we will find all type of stones and where they have located, what is the size of the stones, based on which we will plan our treatment.
And what are the treatment options available? As you said that after diagnosing, after making sure what is the size, what is the position, etc., we decide the line of treatment. What are the treatment options, doctor?
Actually, for smaller stones which are less than 3 to 4 mm, we recommend to take more water daily up to 3 liters, and then avoid the non-veg protein diet, then avoid salt, and the salt restriction should be less than 50 millimoles per day. Then any medical problems which they are having previously, like parathyroid or something, they have to treat that so that they will not have chances of stone formation. So with these managements, smaller stones can be managed easily. For bigger stones which are more than 5 mm, the chances of spontaneous passage will be difficult because the ureter size will be 3 to 4 mm. So if the stone size is more than that, so the chance of spontaneous passage of the stone will become difficult. And above 8 mm, it is hardly less than, we can tell, 1 to 2% of chances of spontaneous passage. They may need some kind of intervention in the form of minor surgeries.
Right. Many times we have seen recurrence of kidney stones in many patients. Why that happens and what prevention or precaution they can take?
Actually, stone formations happens because of the water intake, and even one more important thing is the water density. What is the type of water which we are using? In some places, there will be high stone formation rates because in the soil there will be more of minerals, and if they consume the bore water, they will have more stones in those regions. So if the patient is having recurrence of stones, then we should think from which area he is hailing and what type of water he is consuming and what is the quantity of water he is consuming, whether he is taking more of protein diet and more of salt. Other than that, we have to check for any medical problems like increased serum calcium, increased serum uric acid, which are also a triggering factor for the recurrent stone formers.
Okay. Doctor, we have seen many patients, don't go for treatments even after the diagnosis, because of course, after the test, after the diagnosis, the doctor can get certain that, yeah, there is a kidney stone and this is the position of it and this is the size of it. But many times people are so scared of, surgeries or even medical management that they don't follow the treatment. They'll go for other therapies. They'll keep on increasing their liquid intake, but they won't take the treatment. What are the potential complications if we keep ignoring our stone, even after, knowing that there is a stone? And what could be the potential complications there?
Actually, only an expert should give the opinion whether the stone can pass or not. And the patients treat themselves as the experts and they think for that person that stone has been passed. For me, this stone will definitely pass like that. They will individualize themselves, but it is not so. The expert has to see the stone, what is the size of the stone, in what location it is, and since how many days it has been there, and what are the complications which has occurred because of the stone. Because the stone can lead into infections, can lead to kidney loss. So based on that, we will tell this stone definitely needs treatment either in the form of medical management, which has to be checked regularly. Like if you give a medical management, again we recheck whether the stone has passed within a week or so. If it is not still passing, then we will recommend surgery. And in some patients, based on the stone size, if it is a bigger stone, we will directly recommend a surgical treatment if there are associated complications also. Patients do take self-medications from the over-the-counter like painkillers, which will reduce their pain, but the stone will not be passed. They don't know that. They will think pain is there because of the stone. If I don't get a pain, there is no stone. This is their dictum. Actually, it is not so. Our body tries to adapt to the conditions which it cannot struggle for much time. It initially struggles and tries to pass the stone out. That time the patient will have pain. After that, our body slowly gets adapted to it and there will be no pain. For some days, they don't realize that time period. For maybe 1 month, 2 months, or 3 months, they will not have any pain. But again, they will start having pain. By that time, the kidney will be swollen and other side effects might have been occurred. We have seen many patients who have lost their kidneys for a simple stone, and they may even turn up into CKD patients necessitating lifelong dialysis, which is not necessary from my point of view, because a small stone which can be tackled with many new technologies which doesn't require major surgical things and with less complications to the patient. So very simple surgeries now we are having.
Right. So the bottom line is, in case you have these symptoms, please go and consult a qualified urologist, a board certified urologist as soon as possible. Do not ignore the symptoms. A, B, don't self-medicate. Don't go by home remedies. Don't go for other therapies. Don't go for what the influencers on various social media platforms are asking you to do, because it's your health. Eventually you will end up wasting your time, your money, your energy, and most importantly your health, because there are potential complications if we leave it untreated. So don't compromise, don't risk your health. Go to a doctor, go to the right person and seek advice and follow the doctor. That's really important, that you follow the treatment. And now, doctor, as you're talking, yes doctor, would you like to add something to it?
Yeah, and they should never compare with the others, because some person might have passed a stone which is slightly bigger than you. You may think, I will also definitely pass that stone. He is entirely different, you are entirely different, his anatomy is different, your anatomy is different. And based on the individual scenario, we will decide whether they may pass or they may not pass.
Doctor, as you said, you at the first thing after diagnosis, if you find out that the stone size is not much, it's smaller, then you advise to increase their liquid intake so that it spontaneously can flush out. My question to you is, after that, for example, if a person is, just on water, I mean, they are taking excessive liquid intake as their first, protocol in that treatment thing, after how much time they need to go and recheck themselves whether the stone have flushed
Yeah.
away or not?
Actually, when we suggest medical management or some kind of like a fluid therapy for them, then they should check whether they are passing any smaller stones. If if they have seen with their naked eyes that the stone has been passed, then that is the confirmatory. Other confirmatory thing is again in imaging modality. We have to go for another imaging modality, maybe after a month or 2 months, so that will confirm whether the previous stone was present or it has been washed out.
Right. So 1 month or in 2 months, we need to get ourselves checked, rechecked rather again, to just to confirm. Otherwise, we'll follow the next step of treatment as advised by the doctor. Doctor, we would also like to know, many a times people who have stone, they are so scared of the term surgery. Though nowadays there's so much of advancement in medical science, in technologies that's there, especially for kidney stone treatments. Would you like to shed some more light over various advancements that's in, and why we should not be scared of the term surgery?
Yeah, actually, there is a phobia in a patient that the surgery means there will be some cutting of the skin and they will have pain and they have to be staying in home for some days and they cannot go to their work. So they have these many phobias. But nowadays, especially in urology, we have come up with many advancements like we do treatments endoscopically. Endoscopically means there will be no cutting on the skin and we follow a nodes pattern. Nodes means natural orifice. Through the natural orifices, we'll be doing the surgeries. So we will pass our instruments through the natural passage of urine, go to the stone. Even if the stone is situated in the kidney, we can use a laser technology, which we call it as RIRS, retrograde intrarenal surgery, through which there will be no pain to the patient and there will be patient need to be staying at hospital for only one day. It has become like a daycare procedure. They can come, get the surgery done, get the stone cleared. They can go in the next day morning to their homes. And even if for a larger store burden also now better lasers have come which can clear stones up to 2 to 3 centimeters, even 4 centimeters we are attempting to clear through RARS. And for bigger stones which has occupied whole kidney, we will do a PCNL, which means a small hole will be kept to the kidney, and through that hole we will pass our instrument, clear the stone completely, so that patient will have less morbidity and the patient will be more healthier than when we compare this with the previous surgeries when we used to do open surgeries, retract the kidneys, open the kidneys, take out the stone. Those morbidities are nowadays not there. We have come up with many new advancements like lasers and PCNL treatments. So patient need not to worry about stone. Anywhere in the body, if the stone is present means we can take it out. Aram se we can take it out without any problem to the patient.
Fair enough. We all know, and you also emphasized on the fact that we need to have proper liquid intake, which is very important, especially for kidney stone formation. For not, I mean, non-formation of kidney stones, we can definitely have a good liquid intake. My question to you is, Doctor, how much fluid should a person drink in a day, keeping in mind that it's summers in most parts of our country and we all are
Generally,
sweating?
yeah, recommended is like 2 to 3 liters, but again it depends. If a patient is sitting in an AC like me without doing any hard work, only mental work we may be doing without any hard work, 2 to 3 liters is enough. But a patient who goes into the sun doing external hard work, he may require some more water. And our body keeps on telling you are thirsty, please drink. Patient never should misguide from this point of view. He should take whenever a body tells you have to take, I'm thirsty, please take water, means he has to take the water. Don't skip or don't postpone taking water to some other time because I'm at work. I should not take. I may lose my work like that. They may be thinking, but water intake is very important, and you can take more than 3 liters if you are doing hard work in the summer.
Right. And any dietary do's and don'ts for all of us so that, we don't end up forming kidney stones?
Yeah, main important thing is the water intake, and the second thing is animal protein. It should be reduced to 50 grams per day, and salt restriction. Salt restriction also is very important, and some oxalate forming dietary foods will be there, like chocolate, spinach, tomato, which we need to reduce those quantities. And we have to check for any recurrent patients with stones. We need to check for whether his uric acid levels are high, whether his calcium is high. So what is the stone composition? Based on that, we can suggest him some other treatment so that he cannot have any recurrence.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers?
Yes, now the summer is there and it is the most patients will turn up with stones in these summers. So do drink lot of water of more than 3 liters. Try to avoid animal proteins and try to avoid pickles and food items which contain more of salt. and stay at home, stay healthy. And if you have any symptoms, please do consult your doctors and take their expert advice, because any quack can tell anything from their mouth. That doesn't mean it has a scientific evidence. Only a qualified doctor who has expertise in these things will guide you correctly, and which will lead to potential loss, which may prevent you from the potential loss of your kidneys, and it will ensure your kidney health.
Thank you so very much, Dr. D. Srikanth Reddy. It was wonderful talking to you. Thank you for your valuable time, Doctor. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times with you. Thank you.
Thank you.
And thank you, viewers, for joining us. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye. Take care.